So we are already live. So I hope my screen is visible to you.
Yes.
All right. So we will start. With all your due permission, we are beginning with the session for today.
Yes.
Good evening, everyone. This is Vitull from IGCP, and I would like to welcome all the viewers who have joined our platform for the better exchange of knowledge that is going to be shared by our keynote speaker, Doctor, for today's session. With great honor and pleasure, I would like to introduce Professor Dr. Vitull K. Gupta, sir, who is a very renowned internal medicine. Sir is MD in Medicine, FICP, FCSI, FACP, FIACM, Health and Human Rights Activist, Honorary Teaching Faculty at AIIMS, Bhatinda, Consultant at Kishori Ram Hospital and Diabetes Care Center, Kishori Ram Road, Basant Vihar, Bhatinda, Punjab. With the help of sir, we'll be taking a close look on today's topic, which is supplemental proteins and medications. Are they cardiac friendly? A very important topic to have our eyes on. Before moving on to today's session, let us have a brief look on what the topic says. The cardiac friendliness of supplemental proteins and medication depends on various factors, such as the ingredients dosage and individual health conditions. While some supplemental proteins and medications may have cardiac benefits, while others can potentially pose risk or interact with existing heart medications. This webinar provides a manual to ensure safe and appropriate use of nutritional supplements in individuals with cardiovascular concerns. So now we will hand over the forum to sir for his specious talk to begin. Sir, over to you and welcome at our forum, sir.
Thank you very much. Thank you, IJCP and MediTalks, for giving me this great platform to interact with all the delegates about the topic today, that is supplemental proteins and medications. Are they cardiac friendly? Next slide. So that is what we are going to discuss in next few minutes. Next. So I start this lecture to paying tributes to my late father, Comrade Ved Prakash Gupta, and thanks to my friend, mentor and guide, Professor Dr. Gurpreet Singh Bondar, because all my academic activities are under his guidance for last 45 years. Next. So what we are talking today is supplemental proteins as well as medications. Are they cardiac friendly? We all know diet generates a lot of interest, and protein is a big business. You will find protein supplements here and there, young people taking protein supplements. But the question is, how many of us really need an extra protein? There is no doubt that protein is an essential part of our diet, and we need it to build and repair muscles, to help our bones stay strong, to maintain the immune system, to keep our brain, heart, skin doing what we need from them to do. And the composition of macro diet is from, that is 45 to 65% of the calories from carbohydrates, 20 to 35% from fats, and 10 to 35% from protein in different combination and permutations. These are the macro components of our diet in percentages. Next. So what are supplemental proteins? It is increase in dietary protein intake and protein supplements. So both we consider it as supplemental proteins. Next. The dietary supplement or food supplement or nutritional supplement is a preparation intended to supplement the diet and provide nutrients that may be missing or may not be consumed in sufficient quantities in a person's diet. So that is what we call as supplements. Next. The supplements proteins can be from animal sources, that is meat, fish, chicken, egg, milk, cheese, and yogurt, or it can be from plant sources, mainly from legumes, nuts, and seeds. Animal foods tends to be complete protein, which means that they contain all the 9 essential amino acids. Some plant food contains all the 9 essential amino acids, include soya protein, quinoa, and chia seeds. However, some plant proteins lack one or more essential amino acids, so it is important to eat variety of plant proteins from different sources. So that means the plant proteins needs to be mixed, that we can have different plant sources to make it a complete protein diet, including all the 9 essential amino acids. Next. The protein supplements are typically used in conjunction with the proper diet to increase total protein intake. The protein supplements can be in the form of animal sources or plant sources. The protein supplements may consist of casein protein, whey protein, or soya protein, or egg albumin, goat, cow milk, wheat, beef, pea, hemp, or brown rice. Next. And if we want to go deeply, the protein supplements can be from isolates. So that is a protein source. Concentrates which are not as pure as isolate form, but they are in concentrated form. Hydrosylates which are chemically or enzymatically digested, resulting in the product that is quickly absorbed. Blends, a combination of various protein sources at different purity levels, that are called blends. So these are the 4 types of protein supplements which are available as such. Next. Amino acid supplements also contain protein, are included in protein supplements. So amino acid supplements is in lower dosage in isolation or for specific purposes, whereas protein supplements can be non-specific assortment of amino acids in large amounts. So supplements can be in the form of ready-to-drink shakes, bars, bites, oats or gels, and powders, and they come in variety of flavors and consistencies. Next. So question is, how much protein do we need? The amount of protein each person needs varies, but according to the guidelines, it should consist at least 10 to 35% of proteins of all the calorie requirement. It depends upon your age, gender, but it may also depend upon your lifestyle and health too. Teenagers, pregnant women, and older adults and athletes all need more proteins. The amount of protein recommended each day for an average person can vary from 0.8 to 1.3 grams of proteins per kg body weight. So that is an average requirement which consists of the calorie requirement, that is 10 to 35% of all calorie requirement. And if we take it by kilogram body weight, that is 0.8 to 1.3 grams per kg body weight. Next. So for the viewers, these are the protein components of the diet. That is, chickpea contains 7 grams. I will not go in detail, but here I will like to mention that meat has got more protein, where soyabeans also have more proteins, including almonds also. Next. So these are the various protein components of the diet which we commonly use. Next. Next. So we can take this diet from internet, or it is available on in literature. Next. 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 So protein requirement is more for athletic population as well as general population. They are different, subject to much scientific debate. So that is why we are discussing this, that protein supplements and medications, whether they are cardiac friendly or good for health. Despite the prevalence of high protein diet in athletic and sedentary population, data concerning the type of protein, the quantity, and in which form it to be consumed is limited. So there is paucity of scientific data for this subject. Next. Rapid increase in prevalence of obesity combined with lack of effective dietary and pharmacological treatment has fueled demand for alternative dietary approaches in particular the high protein diets. High protein diets gained widespread popularity, and advocates of such diet often recommend protein intake above the recommended percentage of total energy, an amount that are substantially higher than the average consumption of protein. So those are proponents of high protein diet, which advocate that high protein diet is treatment for obesity as well as for health. Next. So the main question what we are going to discuss after discussing what are supplemental proteins, what are the protein components of different diets, we are going to discuss that are supplemental proteins cardiac friendly. Next slide. Cardiovascular diseases are leading cause of death, and diet has major impact on several modifiable risk factors for cardiovascular diseases, namely hypercholesteremia, hypertriglyceridemia, elevated low density lipoproteins, and low HDL, hypertension, obesity, and diabetes. So these are the cardiovascular disease risk factors where diet has major impact. Widespread popularity of high protein diets has drawn controversy as well as scientific interest. Next. Increased consumption of fats and proteins replacing and reducing carbohydrates is thought to increase satiety, facilitate weight loss, and improve cardiovascular risk factors. Epidemiological studies show a significant relationship between increased protein intake and lower risk of hypertension and coronary artery disease. Emerging evidence from clinical trials indicate that higher protein diets increases short-term weight loss and improve blood lipids, but long-term data are lacking. So this is very, very important. All the studies or clinical trials are of short-term, and still we don't have good long-term data on efficacy of such diets. Next. Different sources of protein appears to have different effect on cardiovascular diseases, and data on optimal amount and source of protein is still lacking. Evidence suggests potential benefit of partially replacing refined carbohydrates with protein sources low in saturated fat. So this is being advocated these days also, that refined carbohydrates are very dangerous. So we must replace refined carbohydrates with proteins or the fats, but fat should not be trans fats or saturated fats. Animal proteins are primary source of saturated fats and cholesterol. So positive relationship between saturated fat, cholesterol, and coronary artery disease suggests that regular intake of foods high in saturated fats and cholesterol may increase risk of coronary artery disease. So while choosing our diet, we must know that this protein source should not have more saturated fat or cholesterol. So we must choose a diet which is low in saturated fat and cholesterol and high in proteins. Next. Proteins have an overall benefit on physical activity and overall health. In a study with healthy males, US Marines, the protein supplemented group had 33% fewer total medical visits, 28% fewer visits due to bacterial or viral infections, 37% fewer visits due to muscle or joint problems, 83% fewer visits due to heat exhaustion than the control or unsupplemented group. So we need to know from this study that protein diet, when chosen intelligently, improves overall health. Next. Protein may help reduce blood pressure. A protein mixture consisting of 20% peas, 20% soya, 30% eggs, 30% milk protein isolate reduces the systolic and diastolic blood pressure in overweight individuals. Data suggests that protein intake might help manage blood pressure and prevent complications associated with blood pressure and cardiovascular diseases. Next. Low carbohydrate, high protein, high fat diet promoted by Atkins may be most popular diet used for weight loss in US. A study has shown that Atkins diet can produce greater weight loss at 3 and 6 months than low-fat, high-carbohydrate diet based on US dietary guidelines. The basis behind this diet is that protein is associated with feeling of satiety and voluntary reduction in calorie consumption. Next. Animal and human studies have shown that soya protein is beneficial to cardiovascular health. Soya protein can lower triglyceride levels, total cholesterol and LDL cholesterol, increases HDL cholesterol, and improves the HDL and LDL ratio. Considering the totality of research, daily consumption of more than or equal to 25 grams of soya protein with its associated phytochemical intact can improve lipid profile in hypercholesterolemic humans. Mechanism by which soya modulates the blood cholesterol and lipoprotein level needs further research. Next. Whey protein has the capacity to modulate adiposity, enhance immune function, antioxidant activity, and improve cardiovascular health. Clinical studies have shown that taking whey protein in combination with strength training can increase lean body mass, strengthen and increase the muscle size. Next. In athletes, supplementing diet with additional protein, casein has been shown to provide greatest benefit for increase in protein synthesis for a prolonged duration. However, whey protein has a great initial benefit for protein synthesis. These differences are related to their rate of absorption. It is likely a combination of two could be more beneficial. Next. Studies suggest that different sources of proteins have different effect on cardiovascular diseases, as we have seen for whey protein as well as for soya protein. And moreover, effect of white meat, that is poultry and fish, is known to differ from red meat, which is beef and pork. Diet containing substantial amount of red meat appears to increase the risk of coronary artery disease. Data indicates that substitution of white meat for red meat provides greater health benefits. Next. Compared with red meat, white meat from chicken and fish contains smaller amounts of protein, but substantially less saturated fat and cholesterol. That is what we have discussed in previous slides, that we must choose a protein source with less of saturated fat and cholesterol for greater health benefits. Although protection against coronary heart disease afforded by fish is most likely to contribute to an antiarrhythmic effect of omega-3 fatty acids and other nutrients, including proteins, might also have beneficial effect. Next. Eggs and dairy products should be distinguished from meats. There is little evidence that moderate consumption of eggs has material adverse effect on chronic diseases. But now the newer study has shown that 1 or 2 eggs can be consumed as whole egg, but more than that should be balanced against the calorie requirement of the body and considering the lipid profile of a person. Moderate consumption of dairy products may have complex effects, including risk and benefits, and it will all depend upon health profile, including the lab parameters of the person consuming those dairy products. Next. Partial replacement of carbohydrate staple sources of energy, such as grain products with animal products, may have natural or beneficial effects. Use of plant sources of proteins and fats, such as nuts, soya, legumes, and vegetable oils, may provide greater health benefits and should be considered simultaneously. A study reported that higher consumption of vegetable proteins was associated with a significant decrease in coronary heart disease mortality compared with equal amount of energy from carbohydrates or animal proteins in Loa Women's Health Study. So this is again a matter of great controversy that different studies are projecting whether the vegetable proteins or proteins from plant origin are more beneficial than proteins from animal sources. Next. So what is a protein supplement? Protein supplement consists of plant, eggs or milk proteins, that is casein or whey protein, may include other ingredients such as added sugars, artificial flavorings, thickeners, vitamins and minerals. So all the protein supplements, the ingredients make them beneficial or harmful in long run. The amount of protein per scoop can vary from 10 grams to 30 grams depending on different materials. Next. Protein powders have become increasingly popular in recent years among a wide range of people, from professional athletes to those who are too busy to grab a full meal. So we will see the busy, you can say, consultants or busy professionals who want to have more proteins. They will have rather the protein shakes than full meal, because full meal is time consuming and you can take the protein shake in just half a minute. They assume that supplementing their diet with sports nutrition powder is safe and easy way to add muscle faster and recovery more quickly. Many of these products are advertised as natural or organic and promise immediate and dramatic results. Next. Protein supplements for a healthy, non-competitive adult who participates in recreational sports are usually not warranted. So this is a very important statement, that if a normal person, non-competitive adult, who is only participating in recreational sports, extra protein supplement is not needed. Protein supplements may be counterproductive in sedentary people because of extra calories, because they are taking normal diet as well as protein supplements. So they add extra calories to already taking diet. So that may prove to be counterproductive. Athletes and vegetarians are special population that may require supplementation. Next. Athletes, especially those who train with weights and burn a significant amount of calories for cardiovascular and aerobic training, may require additional supplementation. And that supplementation, mind you, can be dietary supplementation or it is supplemental protein formulas. However, their need for extra protein could be easily obtained through diet, thereby negating the use of protein supplements. Again, I have made this bold because this statement gains an extra importance, that whatever extra protein are required can be easily obtained through normal diet. With supplemental proteins, we have seen the content of protein in different dietary material. So we can add extra protein and thereby negating the use of protein supplements. Vegetarian diets are often low in protein and supplementation may be appropriate, and best method is to combine the two type of vegetarian diets so that we can increase our protein intake even if a person is vegetarian. Next. But the question what we need to discuss today is that, are these supplements actually safe? Under the Dietary Supplement Health and Education Act 1994, protein supplements, like any other supplements, are not regulated by FDA. So manufacturers do not need to register their product with FDA or need approval before producing or selling the dietary supplements. This lack of regulation might result in products with contaminants, as it occurred in 2010 with two protein supplements containing unwanted level of lead, cadmium, mercury, and arsenic. Next. Research has shown that many dietary supplements sold openly do not contain what they are supposed to contain. or contain ingredients that are not listed on the labels. Protein powders often contain hidden ingredients and dangerous contaminants. 2018 Clean Label Project studied 130 of best-selling protein powders and found that about 3/4 tested detectable levels of cadmium and lead, both of which can cause permanent health concerns, including kidney and brain damage. About half of the 130 tested protein powders contain detectable amount of bisphenol A, which disrupts hormone and is linked to numerous health issues. Unfortunately, the organic products were no better. In fact, contained an average over 2 times the level of heavy metals of conventional products. Next. So potential health concerns have risen concerning the safety of high protein diet. In 2001, the American Heart Association published a statement on dietary proteins and weight reduction and suggested that individuals following such diet may be at potential risk for metabolic, cardiac, renal, bone, and liver diseases. So again, this statement gains importance that whenever we need to have, or whenever we suppose we require high protein diet, we must consider all these side effects also before starting high protein diet. Next. The potential health concern associated with a diet of protein consumed primarily from animal sources should be acknowledged. With a proper combination of sources, vegetable proteins may provide similar benefits as proteins from animal sources. Maintenance of lean body mass, though, may become a concern. Next. However, excess intake of protein supplements often lead to health problems, which can have short-term effects like lower blood pressure, erectile dysfunction, diminished libido, enlarged breast in men due to hormonal imbalance, dehydration, and acne. Long-term effects can be unhealthy weight gain, liver function impairment, and renal disorders. And moreover, important drug interactions can be there, as whey protein may interact with osteoporosis medication, antiplatelet medication, anticoagulant drugs, and pain medication, that is NSAIDs. Next. Excess intake of whey and casein milk proteins can cause increased bowel movements, bloating, nausea, flatulence, stomach pain, and diarrhea. Unhealthy weight gain is from unutilized calories from proteins which get converted into fat. That is what we have talked, that if we increase the protein diet, that may add to the calories which we have already been taking. So it leads to unhealthy weight gain. Excess protein metabolism produces ammonia converted into urea, which may cause renal disorders. And there are several reports among young athletes where they increase protein diet that have renal disorders. Excess soya-based protein supplements has phytoestrogen that mimics estrogen hormone, and genetically modified soya contain glyphosate responsible for hormonal imbalance, miscarriage, and even birth defect in newborns. The two other things, that is diazine and gynstein, can cause erectile dysfunction, decreased libido, and enlarged breast in men. So these are all side effects of the protein supplements which contain different ingredients. Next. Protein supplements with no carbs can cause ketosis as body utilizes fat as primary source of energy, impairs liver function, and may result in severe liver disorders. Protein powders may contain harmful heavy metals like arsenic and lead, can experience headache, dizziness, exhaustion, and other issues like risk of poisoning and cancer. Drug interactions may act with antiplatelet medications, anticoagulant drugs, and NSAIDs. Acne is an important factor. Those who consume whey protein increases insulin-like growth factor, which triggers increased sebum production and leads to acne. hair loss. Waste protein boost testosterone levels, produce DTH, which can cause hair loss. Next. So supplemental medications or dietary supplements, they consist of vitamins and minerals. So this discussion has two parts: supplemental proteins and supplemental medications. So these consist of vitamins and minerals, and most of the population consume supplemental medication for prevention or treatment of cardiovascular diseases or general health. You will find several people consuming multivitamins, multiminerals as a routine for healthy life. Available scientific data on multivitamins and multiminerals, antioxidants, folic acid, vitamin E, niacin B, and beta carotene to date fail to support use of exogenous supplements of vitamins and minerals for prevention or treatment of cardiovascular diseases, especially in those who don't have any deficiency of these elements or vitamins. Next. Since vitamins and minerals cannot be generated in vivo, it must be ingested through diet. Deficiencies of these substances have known to cause clinical diseases. Innumerable studies were done to know whether supplementation of vitamins or minerals without deficiency would benefit or not. So this is a very, very important question. The US Preventive Service Task Force states that current evidence for use of multivitamins or other nutrient supplements to prevent cardiovascular diseases is insufficient. Several scientific associations recommend obtaining vitamins and minerals from normal diet or supplementary natural diet rather than in form of supplement, that is capsules or powders or something else as medications. Next. A review of 26 studies examined the benefit and harms of using vitamins and mineral supplements for primary prevention of cardiovascular diseases, cancers, or all-cause mortality in healthy individuals without known nutritional deficiencies. So mark this word, without known nutritional deficiency, and found no consistent evidence that supplements benefited the cardiovascular disease prevention, cancer, or all-cause mortality in healthy individuals without known nutritional deficiency. So that means in a normal healthy individual taking a balanced diet, there is no need for supplemental multivitamins or minerals. Still, if an individual wants to take benefit of increased vitamins and minerals, they should take it from normal diet. A review of 3 trials of multivitamin supplements and 24 trials of single or paired vitamins that randomly assigned to more than 4 lakh participants concluded that there was no clear evidence of a benefit effect of supplements on all-cause mortality, cardiovascular disease, or cancer. Next slide. Dietary vitamins and mineral supplements are not benign. Major and minor adverse effects have been reported in various randomized controlled trials. Dietary supplements in particularly common for people suffering from CPDs. Importantly, in patients with cardiovascular diseases, concomitant use of dietary supplements and prescription drug is substantial, with 58% of patients taking these supplements at risk of potential adverse effects. So this again becomes important because the people who are already suffering from some disease are already on several medications for that disease. So if we add dietary supplements, that is minerals or vitamins, that will increase the pill burden and that may have potential adverse effects from drug to drug interaction. So we must avoid those vitamins and minerals in all people except for those who are having deficiency of some minerals or vitamins. And if at all we need to give them, we should supplement those with our diet. Next. So my dear friends, to end the discussion, the take-home message is no doubt proteins are an essential part of diet for health of human body, but protein is also a big business. The amount of protein needed depends upon age, gender, lifestyle, and health. Average recommendation is 0.8 to 1.3 grams of proteins per kg body weight. So one can always calculate the amount of protein required according to the body weight, as well as age, gender, lifestyle, and health, and more importantly, the exercising athletes. Widespread popularity of high protein diets have drawn controversy as well as scientific interest. Next. Different sources of protein appears to have different effects on cardiovascular diseases, and data on optimal amount and source of protein is lacking. Low carbohydrate, high protein, high fat diet promoted by Atkins may be the most popular diet used for weight loss in US. Protein supplement consists of plant or animal proteins, which may include added sugars, artificial flavoring, thickeners, vitamins, and minerals, and the amount of protein per scoop can vary from 10 to 30 grams per scoop. Next. Research have shown that many dietary supplements sold openly do not contain what they are supposed to or contain ingredients not listed on the label. Protein supplements for a healthy, non-competitive adult who participate in recreational sports are usually not warranted. Athletes and vegetarians are special population that may require supplements. Excessive intake of protein supplements often lead to health problems with short-term, long-term, and drug interaction adverse effects. Next. Supplementation, medication, or dietary supplement consist of vitamins and minerals, which are most commonly used supplemental medications among adults in a hope to maintain or improve overall health is unwarranted. Numerous randomized controlled trials and large observational studies have failed to show any benefit of supplemental medications in the form of multivitamins or multiminerals in preventing or treating cardiovascular diseases. Currently, use of multivitamins or minerals for prevention of CVD is not recommended. Next. So thank you very much. With the message that proteins are important for health, we must choose the protein according to our cultural beliefs, according to our age, gender, the active lifestyle, and moreover, we can, there is no need for commercial protein powders. We can always add or take high protein diet according to whether we need to have plant-based diet or it is animal-based. If it is animal-based, we must choose the diet which has low saturated fat and low cholesterol. Thank you very much. With this, I invite you to 10th Annual Conference of Association of Physicians of India, Malwa Branch, Mapicon 2023, from 21st to 24th September at Hotel Seppal, Bathinda, and you can register online by clicking to www.apimalwa.com. Thank you very much.
Thank you so much, sir. Thank you for such a brief and important topic about the talk that you have delivered today. So thank you so much for that. We have received few questions from the participants and I would like to put it across to you, sir.
Yes.
So we'll move to the first question. And the first question is, does high protein diet induce atherosclerosis?
No, high protein diet will not induce atherosclerosis, as we have discussed. If high protein diet is of animal source, which has more of saturated fats and more of cholesterol, then it will induce atherosclerosis. And if the extra protein, they are taken beyond the calorie requirement, the extra calories again will predispose to atherosclerosis. As such, if we take high protein diet within the calorie requirement and choosing the source which has low saturated fat, low cholesterol, then it will not predispose to atherosclerosis.
Thank you so much, sir, for answering this question. We'll move to the next question. And the next question is there any possibility of too much protein that cause heart palpitations?
No, heart palpitation, again, too much of protein will not cause heart palpitation. Again, extra diet. If we are taking high volume of food, that can cause palpitation, because the heart has to work more to digest protein, digest our normal excessive diet. Otherwise, it will not cause palpitation.
Thank you so much, sir, for answering this question. We'll move to the next question and the last question for today's session. And the question is, what is your take on how much protein is too much? What is your view on it?
Already recommendation is your total calorie intake, protein should be between 10 to 35% of your calories. But if you are a bodybuilder, you can have extra proteins for building your body, but that extra protein needs to be under the calorie requirement. So that is intake, that those are the guidelines, that is 10 to 35% of proteins of total calories. And if bodybuilding athletes are there, they can take a little bit of more proteins because they need to build their muscles. That is the expense of refined carbohydrates and fats.
Thank you so much, sir. Thank you for answering all the questions. That was the last question for today's session. And at the outset, I would like to thank all the viewers who were here with us throughout the session, who has watched our session throughout and have given their valuable time at our platform. And with this, I would also like to thank you, sir, for taking out your valuable time and for being here at our platform and sharing such wonderful insights with all our viewers. We hope that your inputs would definitely help them in their daily clinical practices. So thank you so much for that, sir. And with this, with all your last comments, sir, we can conclude the session here for today.
So thank you very much, IJCP, for giving me this platform to interact with our colleagues about the diet that has generated a lot of controversy. And last message is, don't go for protein powders. If you want to supplement proteins through natural proteins in diet. Thank you very much.
Thank you so much, sir. Thank you. With this, we are concluding the session here for today.
Thank you.